Hello, my name is Liam Albright, and I'm presenting on behalf of collaborators at Cornell Tech. I'll be presenting our work on the design of interactive voice assistants and how might they be tailored to support home health aides in their work in home care contexts. Interactive voice assistants, like Amazon Alexa or Apple Siri, are AI-enabled software agents that use speech recognition and natural language processing to interpret and respond to voice commands. Currently, this technology is popular mostly for information seeking and entertainment use in people's homes. However, there's growing interest in how IVAs might be developed for work settings. We build on this literature by examining the design of IVAs, interactive voice assistants, and how might they be tailored to support essential caregiving work done by home health aides. Aides are paid professional caregivers, mostly women of color, who work in clients' homes to provide care, often with the goal of enabling clients to live and age in place. And for this talk, client is synonymous with patient. Aides tasks range from personal care and activities of daily living to medically oriented care and helping with out-of-home logistics like doctor visits. The work is demanding and complex, and is an especially interesting work context in which to study the potential role of IVAs, since it bridges home settings where IVAs are already common with aides work settings. In prior work, Bartle et al. Used storyboards and video elicitations to understand how commercially available IVAs might play a role in aides work. And we build on this work by attempting to show aides devices that are designed to specifically work for their care contexts. So first, we designed two IVAs that are roughly the same size, running identical software and hardware, but differ in physical appearance. One device, the health kit, looks like an aide's medical kit built into a red, rigid plastic case with a carrying handle. The design suggests the device belongs to the aide and might be carried or controlled by the aide. The other device, the home kit, is a dark wood box that is designed to blend into the home. Both of these devices are wireless. See them on the left panel of the screen. Second, we created an application, the home health agent, that provides multimodal visual and auditory support for specific care tasks. For our study, we focused on managing care preferences task and performing a medical assessment task. And in this case, a leg swelling assessment, as seen in the picture on the right of the screen here. To bypass well-known usability issues around IVAs, we used the Wizard of Oz approach to control our application. So we had one researcher act as the quote unquote natural language processor and listen to user utterances and updated the software state. Interaction sessions with participants were recruited with an ongoing research partnership with 1199 SEIU, United Healthcare Workers East in New York City. And we also partnered with a local senior care center to recruit older adults who receive home care and their aides. Sessions took place at the partner organization offices. The interactive tasks that were part of the sessions had aides using these IVA devices and using the tasks that are on each device. Each aide did one task per device, and we used a 2x2 factorial design counterbalancing the presentation order of IVA device across participants and the order of care tasks. After the participants used the device, we conducted a semi-structured interview, and our findings are as follows. We found that devices tailored to home care may be more acceptable as work tools than personal devices like phones. We found that aides did perceive the IVA as likely to be more acceptable than personal devices. As one put it, my phone is personal. It's personal. This puts private medical problems in one place. The client sees the IVA and it's like part of the job. We also found that providing multiple interaction modalities improves transparency and inclusion. Aides felt that because the IVA spoke aloud, clients might be more accepting of the aide's work tool. Quote, the client would hear it and it would be in front of them. Aides also emphasize the importance of providing visual and voice-based guidance for their own work. Aides explained how in some cases they're not able to read instructions or look at the screen, since the task at hand requires their full visual attention. In such cases, voice-based support would be essential. We also found that IVAs can provide personal care related information to aides across shifts and ease in care coordination. In addition to providing multimodal support for care tasks, aides found it compelling that an IVA could be a centralized store of personalized care information relevant to the client. Aides suggested that an IVA may also be used to resolve disputes among aides who care for the same client by recording what happened in the client's home. We also have findings related to exploring how the tailoring of the design of IVAs to home care work impacts control and privacy. So we found that aides want to be the ones in control of the IVA device. Aides generally saw themselves as being in control of the device and able to decide when to use it or when not to. As one participant said, this machine is for the aides. One aide suggested that the IVA might only turn on in response to an aide, saying, quote, when we say we need it, it will turn on. Participants also strongly associated control of the IVA software with control of the physical device. In particular, physically opening or closing a device equated to turning it on and off. Correspondingly, aides felt that the aide should decide if it's closed or open. We also found that the physical state of the IVA connotates when it is appropriate for the device to be listening. Both IVAs were designed as hinged boxes that could be physically open and closed, properties that strongly influence participants' perceptions of when the device would be on, listening or recording data, and when it would be off, therefore shut down. We also looked at have findings around investigating the strengths and limitations of the health kit and the home kit and their physical designs. Key findings are in line with our design goals, where participants saw the red health kit as explicitly looking like it was intended for healthcare work. One aide told us, quote, it looks more professional. It could be considered like a medical device. However, one aide described that the health kit looks too technical and clients are going to not like that. In particular, aides perceive that the appearance of the health kit might be a drawback for clients who want to maintain their sense of independence. As one aide said, you want them to feel like they're still in home and not in a facility or hospital. By contrast, also in line with our design goals, aides found the wooden home kit to look like it belonged in the home, with participants saying it looked like a jewelry box or part of furniture. However, this also raised concerns around the device blending in too well, since clients may forget or not understand the IVA was for aides' work. Several aides pointed out that clients with cognitive challenge may wonder why, quote, is the aide in my jewelry box? Finally, aides perceive the health kit to be more rugged and durable than the home kit, which are necessary qualities in the aide's work context. The health kit's hard plastic was also seen as more cleanable than the wood, able to be wiped down for the next aide to use. In addition, participants discussed how the device should withstand getting wet if used in the bathroom. Along these lines, participants also discussed how the device would need to withstand client interactions. Quote, if a client starts talking to it, they'll probably panic and drop it and break it, and they will throw it away. 3 key implications from our findings for designing IVAs that enable cooperative home in the work. So first, designers could leverage multimodal interaction to improve cooperative work, as we found early signs that our IVAs might promote cooperative work between aides and clients. In particular, the out loud nature of the IVA interactions may improve transparency, making them more acceptable as work devices for aides, since clients are reassured about the purpose and function of the technology. At the same time, our findings also suggest that the voice-only interaction was not sufficient. Our participants wanted image and text-based information displayed on screen, since some clients may have hearing problems. Aide's power to control the IVA may also be limited in clients' homes. A major goal of our study was to explore the impact of tailoring the physical appearance of the IVA to explicitly suggest it was the aide's work device to be controlled or operated by the aides. Although at a high level, participants saw the IVA as a machine for the aides, questions of who ultimately controlled the device remain nuanced and complex. For example, aides felt that regardless of who the IVA was designed for, since it was in the client's home, clients have the authority to decide about its usage, and aides have to respect the client's decisions. Our findings also yield implications for how IVA designers might build devices that provide users with privacy choices. At a high level, we discovered that the general appearance of an IVA may preserve or compromise privacy. We designed our red health kit device to look like an aide's medical kit. And while participants did think it looked like a professional tool intended for healthcare, they also pointed out that its appearance and bright red color may compromise the privacy of some clients who might prefer to keep that private and that they receive professional home care. On the other hand, findings suggest that the wooden home kit sometimes did too good of a job blending in, leading to concerns that when aides use the IVA, clients might think they're rifling through the client's personal belongings. Future work might explore how providing people with more choice over the color, form factor, and general appearance of the IVA might better support users with diverse needs or preferences at home or at work. Thank you Thank you for listening to my talk about our work and our paper that explored the impact of tailoring IVAs for home healthcare work. Thank you, and we welcome questions.